thank you for letting me come by today, and thanks to those great volunteers from the Bush School for helping pack some of those boxes. I know that there's been unprecedented demand on our food banks across the state, across the nation, and this is part of the solution to the challenges that we are facing. As you know, after the virus began spreading, we not only had a public health crisis on our hands, we had an economic crisis as well. And Congress has acted quickly and boldly. We don't always get it right, but I think we got it pretty close to right in terms of the expedited response to that two-front war, the public health battle and the economic battle. So the last major piece of legislation we passed out of the 4 bills we passed was the CARES Act. Altogether, we appropriated about $3 trillion. And if you had ever told me I would have voted for a $3 trillion bill, I would not have believed you. But this was an emergency. I think this is a domestic equivalent to World War II. And so as our heroic healthcare providers are serving on the front lines of this battle and are really doing an incredible job, it's only appropriate that Congress do everything we can to help them do their job by providing things like personal protective equipment and making sure that they are safe while they work in these essential roles. But it's not just our healthcare heroes, it's the grocery clerks, it's other people that are working, learning to adapt to this virus and learning how to do so safely. That's why I'm especially glad to be here today with the educators here in the area who are perhaps during a little bit of an uncertain time, gradually transitioning the students back to in-person education and giving them choices whether to do it online or in person. But I think their success, and I do predict they will be successful, will give the rest of us a lot of confidence to know that even though this virus is not going away anytime soon, that we can safely re-enter society, we can get on with our lives until such time as a vaccine is found. But as you can see, there's a number of places where the money that Congress appropriated went, and I know we've got some outstanding speakers here behind me who can talk specifically about what the impact has been. But we know that in Texas, because we don't have an income tax, a lot of what local government depends upon is sales tax revenue. And when everybody is locked down to try to bend the curve and try to keep from overrunning our healthcare facilities, that meant that they didn't have the revenue to pay for things like fire, police, first responders, and the like. And then there's the irony of our hospitals, literally because they had to forego elective procedures. They had to, some of them were in danger of having to lay people off, even in the midst of a pandemic, because of course we wanted to make sure they had the capacity they needed to serve patients should there be a surge in demand. And then I've already mentioned the importance of our education system, and a lot of kids will start out the school year online and then hopefully transition into a in-person education experience. And I know I'm talking to Chancellor Sharp, that's happening at Texas A&M. So I'm glad to be here, but looking forward to hearing more from these folks behind me about how they've been able to put these resources to good use.